Hello, everyone, and thank you for joining us for the keynote address at day 2 of NextBreath. Before we get started with the session, I want to go over a few items related to technology and how we can all interact. You'll notice both the event-wide chat and the main stage chat. You can utilize the main stage chat to interact with all those who are attending this keynote. If you would like live captions during the event, please click the CC icon located at the bottom of the video feed. Please note captions are not available if you are using the mobile app to view the event. The focus of this keynote is to share lessons learned from our respective transplant journeys. And I hope that those watching in their various stages of the transplant process, pre or post, come away with new insights, tips, and tricks to ensure your life after transplant is as successful and rewarding as possible. To know that the transplant isn't simply about the surgery itself, it's a new life that has its own demands. So we hope this chat helps to highlight and alleviate concerns that are not much discussed or even thought about at transplant centers, but that we all stay awake at night thinking about. Towards the end of the presentation, we will be answering your questions. So please submit your questions at any time by clicking the main stage chat on the right side of your screen, then selecting Q&A. We encourage you to like questions so we can prioritize the questions we answer in our limited amount of time. We will do our best to answer as many questions as possible. As a reminder, I know you're all aware, but this question and answer session is not intended to be a substitute for medical advice, diagnosis, or treatment recommendations. Do not make any changes to your own treatment plan without first consulting your care team. If you have any technology problems during the session, please visit the Tech and Program Support Room accessible on the left side of your screen under the Help Desk tab. Now it's time to introduce the rest of our speakers. It looks like it's just going to be me and Leslie. Lauren is not feeling well, but we wish her well and hope she can recover. So I'll start with, I would like to introduce Leslie, who is 26 years, if I'm right, post-transplant.
Yep. Hi, everyone. My name's Leslie. I am 60 years old now. Didn't believe I'd ever live to be this age. I was diagnosed at 16, had my transplant at 34 years old. Like I say, I'm 26 years post-transplant. I enjoy spending time with my family, which includes my husband, my son and his wife and 4 beautiful grandchildren, and the rest of my family and friends at our cottage.
I am Stephen. My name is Stephen Tyson. I am 12 years post bilateral lung transplant. I was diagnosed with cystic fibrosis at 3 months old. Like most of y'all, sort of a gradual, sometimes rapid decline. The transplant process itself was a time-consuming, arduous, more decision-based. I was really sick for a long time. We all know the drill with frequent hospitalizations, IV therapies, non-tuberculosis, mycobacterium, just the litany of CF issues, low weight. Now, when I started the transplant process, I was at 18% FEV1. And it took me 3 years to finally agree to be listed, even at that physical condition, because I wasn't ready mentally. Because of hopefully some of the stuff we could talk about today is how big the mental aspect is of transplant. I was transplanted at a center in Texas that was not affiliated with my CF center. The transplant itself went well, but I have switched centers and I am now a patient at Duke University, where I have been a patient now for 10 years. And my post-transplant journey has been, knock on wood, pretty fortunate. 12 years, I've had no instances of rejection, no instances of infection. I've not been hospitalized once for my lungs. I've had a few instances of flu and some other various viruses, but nothing that has truly impacted my lungs. But that is not to mean the transplant has cured CF or reduced any medical burdens. That is not the case at all. And there's been issues with skin cancer, there's been kidney issues, there's been stuff that sort of talked about pre-transplant, but doesn't really impact you until you're truly in the post-transplant phase. But I like, in my spare time, I like to ride my bike. I ride my bike about 200 miles a week. I work full time. I live in Raleigh and I travel a lot. I like to travel internationally. And these are all things I can do more now that I'm healthier post-transplant. So let's start with question one. And I'll start with, well, Leslie, what piece of advice would you give to other people with CF who are just a few years post-transplant?
I think the biggest thing for most people is advocating for yourself. I know I've had a few instances where I've had to be firm with doctors because they're not listening to me, or they think it's just, oh, it's just all in your head, you're going to be fine. So you got to advocate, and you have to keep bugging them till you get where the answers you need. I went to my GP. I don't have him anymore now, but I went to my GP. It was 2018, and I said to him, I think I need to have a colonoscopy. And I mean, it's not something you just say, oh, I think I want to get my nails done. Nobody wants a colonoscopy. And he said, oh, no, you're fine. You don't need one. You're not due for another 6 months. And I said, no, I need to have one. I didn't have any symptoms, but for just some reason, I had this nagging feeling. And they did the colonoscopy, and sure enough, I had colon cancer. They removed part of my bowel, and I didn't have to have chemotherapy at that time, and everything was good. So you have to make sure you keep fighting to get the help you need. I've had a couple of times where that's happened to me, where people don't listen. And you just find the doctor that does.
And I think from my perspective, jumping off from what Leslie said, I think the biggest thing I've learned post-transplant almost immediately, and also even in the pre-transplant phase, is that your transplant center replaces your CF center. Your transplant center is not your CF center. It's a whole new set of doctors, of nurses, of dietitians, of psychologists. It is not your CF team. And some of us are more fortunate to be at centers that are affiliated, integrated with our CF team. And that makes it easier for the cystic fibrosis patients to sort of slide in and to have that continuity of care and to have that recognition that, you know, we can't sort of, there's nothing they're going to miss, or there's no argument over who's going to take care of what. I am a post-transplant patient. I haven't seen my CF doctor in 4 years. I don't see anybody related to my CF team. It's all transplant, but the transplant center, the one I am at now, takes care of everything for my CF as well. They remove that burden from me, and they remove that burden from the CF center. Now, the CF center is still looped in. They are kept abreast of my appointments, of my progress, of anything that may touch upon CF. So, for instance, sinuses. But that is not the case at all transplant centers. And I think the biggest thing I learned is that's one of the reasons I switched centers, is because the transplant itself is not the end of our CF journey. It's really the beginning of a new journey, and you have to have a team that is around you and supports you and knows how to take care of you and knows what to do. There's some baseline things that need to be accomplished. And like Leslie said, the advocacy for yourself and the people around you who can step in for you when needed and say, hey, this is not correct. And to recognize that not all transplant patients need the same treatment. It's not like CF where you go in and, you know, we all take albuterol, Pulmazine, Toby, Trikafta. Transplant is everybody. We all have a litany of some drugs, but sometimes you're on more, sometimes you're on less, sometimes you're on not at all. But that's incumbent on your transplant center. And that's incumbent on your relationship with the transplant center. And that's the biggest thing I've learned post-transplant, is how important it is that you select and you be comfortable with your transplant team, because they are the ones that take over your care.
Yeah.
And Leslie, what have you? What have you learned or had to navigate post-transplant that you didn't think you would have to?
The difficult times when you don't want to show your family, like everybody thinks, oh, you've had a transplant, so it's all good. You're always happy. Well, you do have bad days, but you don't want your family maybe to see that. So it's hard to just take some time for yourself, and you can have bad days and lay down in bed and cry if you want. And it's not a bad thing. It's going to happen. You can't always be positive, but I find for myself, I have to keep busy. I either have to work or do a hobby or something, try to get my mind off of it. Just also think about the good times ahead. Don't always dwell on the bad, because it does get better. You have good and bad days, and you have to learn to deal with them both.
Yes, I would say some of the most, or the few foremost surprising things for me was the fact that most of us have struggled breathing, of course, prior to our transplant. That's why we're getting transplanted. And you get the new lungs and they pull the tube out and you breathe worse than when you were transplanted. And it's really a shock to the system. Everything is much more difficult than when you went into the transplant. The CF is as bad as it is a risk, but we can manage it, mold it, contain it. Point A, point B. A transplant, everything's off the table. And it's learning how to take care of yourself in a new way and not to compare yourself with, when I had my transplant, I was transplanted with sort of a cohort of other CF patients, and some did better than me initially. Some did a lot better than me. Some did worse. My problem was I was comparing myself to them and their progress. I would get really upset at myself when I saw their FEV numbers after 6 weeks, or if they weren't as frequent visitors at the hospital as I was post-admission. And it would really set me back mentally because, like Leslie said, we had this, you get the transplant, you're supposed to be 100% grateful.
Yeah.
And of course, you think about your donor family and you don't want to, you're gratified. And there's still a lot of tough days that are sort of ancillary because of the transplant, whether it's the kidneys or your mental health or your fatigue or and everybody around you is like, oh, but you're not as prominently sick.
Yeah.
And it could really
coughing anymore.
Yeah. You're not coughing anymore. Yeah. You're not in the hospital as much, hopefully. And that could really be a double-edged sword. And it's tough, especially at first, to sort of recognize that I had a transplant and it's a big surgery. It's a big recovery. It doesn't take weeks to get better. For instance, my FEVs have gone up every single year. So I was a slow starter. My FEVs after transplant were like a little blip from 18 to 30%. I was also afraid to blow into the PFT machine because I was afraid I'd break my lungs. It's not logical, but these are things you think about post-transplant. You've got this new gift of life. And so one of the biggest things I did that helped me is actually remove myself from everything CF related and CF friends for a good period of time. And it helped because I didn't have that wondering what if and why are they doing this? Why isn't it happening to me? So that was the shock for me, was just the switch. The lungs are okay, but now it's everything else.
Yeah. I know what you're saying about the PFT machine. I even do that now. I go every month for my PFTs, and if they haven't changed, I'm like, oh, I got another month to live. That's how I've done it all 26 years, basically living month to month. So then I would skip a month once in a while just to give myself a break.
I mean, Leslie, but what have you done thinking of transplant centers, like what are the hallmarks to you, or at least your center, that makes you comfortable there, that makes you...
See, we don't have, like, I'm in Ontario, we only have Toronto General, and I'm not sure if Kingston even has a transplant center. So Toronto's the only one. So I don't really have any choice to go anywhere else. I have been comfortable with them, but they change people. You know, I get 26 years, I've known a lot of the people, the doctors and the coordinators. And then when they change someone, it's like you got to get to know them all over again. And they don't really know you. But when you've been 26 years out, sometimes I feel like I'm just a number, or, oh, you're 26 years now. You've had a good life. What more do you want? You know, I have chronic rejection now, and they talked about last year that I should consider having another transplant. So, because my breathing is not very good, excuse me. But yeah, it'd be nice if it was all the same people that I've known for years. Then you're more comfortable with them, right? So that's something that you have to get used to. Is, you know, if I go to another doctor, they'll say, "Who's your transplant doctor?" Or who do we get in contact at the hospital? I'm like, I don't know. I see a different doctor every time I talk to somebody. There must be 20 of them. I don't know how many there are. I never had the same doctor twice. So that's not so fun.
And see, that's for you and I different, because I've had the same transplant doctor
for
years. It's the same doctor I see at each appointment, at each My Chart liaison. I have his personal number. I have his email. But I think also surprising to me was, unlike CF centers, and we're all accustomed to CF centers, the standard of care and the uniformity. So if I switch from UNC to Pittsburgh, the CF center is going to be relatively the same. The treatments and the interpersonal relationships might be different, but that is not the case for transplant care. There is a wide divergence in transplant care post, in frequency of labs, in surveillance care, in thresholds, and it's research. I would say the biggest thing is to research your center. Look at what they're doing with other CF patients. Talk to the patients in your community, how the transplant center is reaching out to them. How effective are they in removing any sort of administrative burden on your side? So all you have to think about is staying healthy. You don't have to reach out to them to have your labs taken. You know, I'm up at Duke probably for appointments every 3 months, every 3 to 6 months. That's not including labs for the immunosuppression and the kidneys. And so I always joke about, I know we talked about this earlier, Leslie, in a pre-chat, but if our friends and family got a peek at our real sort of transplant burden, appointments and labs, and if I had to share my calendar with my coworkers, I think they would kind of be shocked at how much they don't know goes on post-transplant care. And part of that is my fault. I don't want them to know. And because we're all, we're still here and we're still kicking.
Yeah.
But it is a lot of work. It's not get the lungs and that's it.
No.
That's not the case at all. And that was a big, big shock to me.
Like I have doctors for everything now. I have a kidney doctor. I have a bowel doctor. I have a diabetic doctor. So you got all these different doctors that you have to see, and they all report back to the transplant, because the transplant they only want to know about your lungs. They don't want, at our center anyway, they don't want to deal with any of your other issues.
Yep.
You go to some other doctors for that. They only want to take care of the lungs.
Yep. And that's definitely been, we were spoiled by CF centers.
Yes, that's right.
We've all been spoiled by CF centers. And my biggest takeaway is keep your luck going by finding a good transplant center. Yeah. If you are not comfortable, you have to advocate for yourself. You have to be comfortable and say, this isn't how I think it should be. like Leslie mentioned earlier, like this is a hugely important life decision.
Yeah.
And it's paramount. Those first few weeks are hugely important. And you need to be comfortable and in a place that recognizes how you even look. Like I'm sure at our CF centers, we could show up in an appointment. We wouldn't have to say anything. We couldn't even spin a lie and they're going to already know that we're full of it.
Yeah, my doctor would say, oh, you're not feeling good today. I can tell because you don't have any makeup on and your hair's not done. Like they could tell.
Exactly. And that jump from the CF center to the transplant center, especially if they're not affiliated, can be quite perilous and difficult because you have to build that relationship.
Yeah.
And ideally, you want to be at a great transplant center that takes care of you, like Duke, like the center I'm at now, where I don't have to worry about anything, literally anything. I feel like if I sneeze here, they're going to know about it and email me. And that's what you need. A transplant is a serious thing. And Leslie, like I know it is challenging. Like it is a challenging experience. How do you push through like the hard days? How do you adapt or cope on the really tough days where everybody thinks you're a transplant patient? Look at you, you're doing well.
Yeah, or people will say, oh, you're so strong. Well, you don't have any choice. I think everybody with CF is a strong person, but you have to keep fighting. You just try to remain as positive as you can and just think about, well, I wouldn't have been here 26 years if I didn't have a transplant. Yeah. Even if I had survived just 1 year, it still, I think, would have been worth it just to do the things you want to do.
And I would say I agree, like 100% agree. Also, at least for me personally, it's the recognition that even as we get older, and I'm getting old. I mean, I never thought I would live this old.
I know, me either.
And it's kind of crazy, but it's also even healthy people with no transplant and no CF at our age have bad days.
Yeah, that's right.
And our thing is we sort of have to embrace the bad days, but make sure that you turn it into a less bad week, a bad month, a bad illness. So if I have a bad day, I just take the loss. I just literally shut down everything. I don't do anything on a bad day. Because I think the thing that's been surprising for me post-transplant too is how quickly it can change. Some everyday activities can really put us in a bad spot. And if you're already feeling bad, going up, especially now with COVID or during flu season, there's still some stuff I will not do post-transplant. Now, everybody's different, their threshold of risk. I have a few things I will not do, and I have not done post-transplant. And because the transplant it's life-sustaining, and I'm not going to risk it doing some things that the transplant centers talk about, whether it's eating a salad at a restaurant, eating raw food, riding the metro with hundreds of unmasked people. Yeah. I've been wearing a mask on airplanes and metros since my transplant, 2011.
What about birthday cakes? When people blow in the candles, do you eat the cake? Not me.
Yep, I don't eat buffets as much as I would like to. As much as CF patients, it would make my life really easy to eat.
I think COVID taught us a lot.
Yeah.
Things you didn't really think about.
But I'm definitely not going down because of a buffet.
No.
Definitely not falling down for a buffet. And it's keeping those things in mind that, okay, I can't have sushi, but I've had 12 years. Or, I may not be able to eat at Golden Corral, but I won't be deathly ill tomorrow with some virus. And also the recognition of, there was a few things I did pre-transplant that sort of helped me post-transplant that were sort of guideposts in letting me know that I was feeling better. Whether it was, for instance, I couldn't ride my bike half a mile pre-transplant. And there was a certain walk in my neighborhood that was so difficult that it was really just distressing and depressing and like, why can't I do this? And it was sort of what Ella said yesterday we know the body was there, but the lungs weren't. Now for me, it's the opposite. I know my lungs are there, but sometimes my body is not there. And that's a good thing. But I also had these guideposts, like whether it was the bike ride, whether it was something I really enjoyed doing that I couldn't enjoy. Once I could start to enjoy those were like, okay, the transplant is better than I thought. And that's really helped a lot, especially on the tough days. It's like, it's okay to have a tough day. Like, you're 26 years post-transplant, I'm 12.
Yep.
If this was 20 years ago, we wouldn't even be here.
No.
So
did you, I know after I had my transplant, I was so angry with it's kind of weird to say, but angry with my actual old lungs, that after before my transplant, when I was going into surgery, I said to the doctor, can I see my old lungs when I'm able to? And he said, no, you can't. And he said, why? And I said, because I just want to beat them up. Like, I just wanted to destroy them, right? They're probably already destroyed. But then I had to think, no, I shouldn't have thought that way after a while, because they got me to where I was able to have a transplant. But it's like you get mad at yourself for the things you couldn't do then.
Yeah.
You feel guilty for the things you can't do. I feel that way now because my lung function's getting worse and worse all the time, right? But yeah, you do feel. I know I was angry at myself a lot.
I would say I remember I've had a lot of friends that requested the pictures. I didn't request personally. I just like, get those out of here. I'm tired of you. Get out of my face. Glad to see you. But I definitely had some really angry moments, especially as I got more and more sick pre-transplant, and it was obviously impeding my ability to do stuff that I like, or it was curtailing stuff. Whether it was traveling, or I would still travel, but it was really dangerous, and I really paid the price for that overseas. But I just remember being in that moment, and I was still young. I had my transplant when I was 27, so I was 27 when I had my transplant, and I was sick for many years before that, really sick, 3 years sort of waiting, and I was glad to. I'm trying to think. For me, it was never like we all were physically ready for the transplant. But I think the biggest thing for prospective transplant patients, or even the post-transplant patients, is how much of a mental, it's a daily mental struggle and a fight and an internal monologue, and putting things in perspective, and just putting one foot of another on some of the hard days. Like, just some days, like a victory is just washing your face.
Yeah.
But let's get into.
I said there's some questions.
First one for Leslie. Do you still go to your regular CF transplant appointments, even though you're so far out post-transplant?
I don't see my CF doctors. I haven't seen them probably for 20 years. They actually got in contact with me the other day and said, "Oh, we haven't seen you for a long time." My transplant ones, I don't travel down to see them now. They do like Zoom calls now, or I have we have a registration where we email them questions and stuff if you're having problems, and they will call you. But I do see them once a year by a Zoom call, unless if I do have any lung issues where I'm not breathing properly, even worse. The other hospitals around here, there's one big hospital, but some of them don't like me coming in there. They want me to go to Toronto because they don't know how to deal with the lung issues with someone with a transplant. So we usually just go down to Toronto if it gets really bad. Yeah.
I'd say for me, I don't see CF. I still communicate with my CF doctor, but only after the transplant team has communicated with them. Like, you don't need to see them. So I don't communicate with my CF team at all anymore. And that's been 4 years now. And I am on Trikafta post-transplant. So I'm one of the few that's on Trikafta post-transplant. Obviously, that doesn't impact my lungs, but it has impacted my sinuses. But again, The transplant team takes care of that. They follow that, not the CF team. That was a transplant recommendation, not the CF team. So yeah, no CF appointment, but I do see transplant still 12 years quite frequently for normal appointments, not including labs, which Leslie knows. If your therapeutic levels and your toxicity levels are wobbly, you're going to be there weekly, if not more, until those things are dialed in. So be prepared to spend a lot of time at the hospital, especially immediately post-transplant. The second one, Stephen, how has your relationship been with your transplant team now versus the CF Center team? Well, now it's I don't have I have a relationship with my CF Center, but I don't see them. I see more of my transplant team. In previous, it was the opposite. I had a great relationship with my CF team, but a terrible relationship with my first transplant center. Pretty bad. It's why we decided to switch centers. And that's why I just sort of wanted to emphasize how important it is your transplant center is. It is not your CF center. It's a totally different team. And they could be, at odds with each other. You want a transplant center, and that just takes everything off the CF center's team plate, and you just worry about one appointment. So I would say my relationship now with my CF center is great because I don't see them. Ideally, I never want to see them. So it's perfect. But all my CF centers have been great. The transplant center now is great. The previous one was terrible. Leslie, have you experienced any side effects from the multiple immunosuppressants or anti-infection drugs?
Yeah, like I had lymphoma. They said that was from one of my anti-rejection drugs, which it was called Imuran. I don't know if they even still prescribe it to other people. I don't take it anymore. Other than that, I don't get nauseated or anything like that from any of the drugs. I've had kidney stones multiple times. So I don't know if that's also from the immunosuppressants, but the only one that they tell me with the cancer was from them. That's the only thing that I've had.
Yeah, I would say definitely the skin cancers post-transplant. I see a dermatologist that I
do too. Yeah.
Every 3 months.
Yeah.
Every 3 months, full body check. I have one tomorrow, actually.
Yeah.
And this is a transplant dermatologist, so she specializes in transplant patients. Again, this is part of the transplant center. And I've never not once gone to a dermatologist the last few years and not have something removed or something cancerous. And at this point, it's sort of an in-joke. The first time it was like, oh my God, cancer. Now it's just they get it early, they check it, but that's a sign of a good center. Like that's what you want. That where you're not waiting to show up with an obvious problem. They're looking for stuff and they're taking care of it. So I would say the skin cancers is definitely a lingering side effect that has never gone away. Some of the earlier stuff.
It's funny you say that because that's something that the transplant doctors they just said, oh, you may get cancer, but they never said what types of cancer.
Yeah.
Skin cancer never even crossed my mind, right? Until you start getting these marks on your skin and you're like, it's from the drugs and stuff. Yeah.
I would say that was the same experience for me. It wasn't until I was at my new center at Duke that they were sort of like, hey, you realize the drugs you're on and CF patients, I know we're all pretty lizard-like and we like the sun. I would say the time you spent in the sun pre-transplant is going to impact you quite a bit post-transplant. So be careful.
No more sun. Sorry, folks.
Because you are pouring gasoline on your skin, especially in the transplant.
Yeah.
But initially there was the auras and the shakiness, like I couldn't write my name.
Oh yeah, I still have that. Yeah.
Tremors.
Yeah, you're right.
Yeah.
Tremors, yeah.
Nothing as bad as like that would prevent me from regret doing the transplant. It's a lot of little things, and obviously they're more pronounced than other people. But those are some of I can't really think of like nothing has me at the transplant center be like, oh, this is stop.
Yeah.
If Leslie, do you have any survivor's guilt, especially with your donor lungs? How have you managed that?
Well, in Ontario, when I was transplanted, they wouldn't tell you anything about your donor. I don't know if things have changed at our center yet or not. Yes, I did have the guilt. I wrote a letter to my donor family, but I never, it was probably a year after my transplant, but I never got a letter back from them. It had to go through the center. Yeah, you think about the person because they were probably small or young because, we're not very heavy people, right?
Yeah.
Yeah, you do have that guilt, but you have to think they did a good thing, and you just have to think positively and be thankful.
Yeah, it's
You met your donor family, right?
I do know I have a weird experience with my donor family. They found me before I found them, and they reached out to me while I was in the hospital.
While you're in the hospital?
So I was still inpatient for my
Wow.
transplant, and my donor family figured out who I was and who had received their daughter's lungs. Obviously, this is contra to all accepted procedures and protocol, but they had reached out.
Let something slip.
Yeah, and we're great friends now with the family. I visit them, I talk to them whenever I travel overseas. I send them pictures, and it keeps me going to know that I know my donor's name was Angela, and she was a young woman, and I always think about that in my head, like I'm here because of Angela, and I don't want to do anything stupid, especially that I have a relationship now with her parents and her sister that would imperil her lungs. They're not my lungs, they're her lungs. And I think about that constantly. And we also have, we chat a lot, we email. Some more weird coincidences is the fact that her dad and I share the same name and the same birthday.
Oh, wow.
So her dad is Stephen, and he has the same April 15th birthday. And, pretty nuts. So we always like to joke, we joke about it, but we're definitely like, this is kind of nuts.
Yeah.
The survivor's guilt impacts me more with other CF patients who by sheer luck, it's a lot of times it's sheer luck or bad circumstances, just don't have the same results as us. And I will be the first to tell you, I am not the best patient. I am not the perfect patient, not even close. And I've seen stronger patients, stronger and more compliant patients have difficulties. And that's what bothers me more than my donors. The donor is seeing other CF patients who are
that should have made it.
Yeah, more adherent and more, more cognizant of everything, of having difficulties. And it's also recognizing that some of this is pure luck and fortunate circumstances. So that's, especially Leslie, I don't know for you, but as I get longer in the process, I think about that more. It wasn't as pronounced in the beginning because I was like, 5 years, we made it. Now it's 12 and 26, and it's like, we're still here.
Yeah.
And we've seen how many of our friends have not had a good as outcome as we have. Has Trikafta helped you post-transplant? Leslie, are you on Trikafta?
No.
Okay, so I am on Trikafta. I would say it hasn't helped my lungs at all. It has helped my sinuses. So I still see a transplant ENT here at Duke, but if you saw a CAT scan of my sinuses pre-Trikafta and post-Trikafta, it was like looking at a healthy patient. The cavities are completely cleared out. I no longer need sinus surgeries. I can breathe better. It helps me cycling. I don't have headaches. I don't have sinus pressure. That to me has been really the only benefit. I didn't get any of the weight gain. I've always been pretty thin. So I didn't really get any of the residual, like, oh my God, I have to worry about gaining weight. I ate a full pizza last night and it's gone already. Like, I'm not going to be here. I probably won't even, I'll have to eat 4 to gain a pound. But Trikafta definitely has helped my sinuses. I mean, and ENT jokes that they won't have any more CF post-transplant patients now that they're on Trikafta, and they're going to lose money. So all in all, that's a good thing.
Yeah.
Leslie, what would you advise people who are really sick and ready for the transplant, really sick, but Trikafta improved things for them, but not enough for normality? How should one think about making this decision?
Well, I guess it depends on what your normality is that you want. Like, can you go to work? Can you do your daily routines okay? It is a hard decision to make. And, you can ask your family. And, well, one of my sisters didn't even want me to have my transplant because she didn't want to lose me. And it was my decision. It is nobody else's decision. But it depends on if you're on oxygen. If you're not on oxygen and you can do everything that you want to do, it is a big choice.
Yeah, I would
say.
I think I would agree with that. I think you have to figure out what your normal is and what you're comfortable with, even with Trikafta, pre-transplant especially.
I never had that option.
Yeah, and I didn't.
Years, right?
Trikafta. So it's figured, like I had a few baseline things, I know I mentioned it before, but I had a few baseline things pre-transplant that I really loved to join. Regardless of how sick I was, I would still sort of enjoy them, whether it was going out with friends or visiting my family overseas or just sitting on the porch on a sunny day. It was when those things started to switch, even though physically, I know, Leslie, we were probably ready well before we had our transplant. You just have to figure out what your normal is. Like when the things that you consider normal and are no longer fun for you or worth the effort and the recovery the next day or weeks, that's when it's like, I need to really think about how long I want to go, because then we all know that it's a window for a transplant. And if you're too sick, it's a problem.
Yeah.
But if you're too healthy, but it's also like, it's a fine line. It's really a tough line, but if you're stable and you're still having fun and you're still able to do the things you like, I held off for 3 years. It really took like a jolt for me to, I still remember the day. Leslie, do you remember the day where you were like, I'm ready? Like, this is it?
I was in the hospital with pneumia. And I said to my dad, I'm going on the list today.
Yeah. And I still vividly remember the day I was like, I am done. I'm ready for listed. It was a beautiful October day.
Yeah.
I couldn't do anything. I was so mad. I was in the hospital looking at this gorgeous blue sky and I couldn't do anything. I was sick of it. And I was like, I'm ready. Put me on the list. They're like, finally.
Yeah.
So that's where you have to figure out what your normal is, what your fun is, and when that turns off. And obviously we all have our bad days. And also not making the decision at your worst moment.
No.
Yeah. So I've not had any kidney issues.
No.
I've been lucky, no kidney issues.
Oh, I have kidney stones.
Yeah. Leslie had kidney stones. I've had no kidney issues, nothing that's required dialysis or anything. So I've really been fortunate. So I can't complain kidney wise.
Good.
I think Allie is
kicking us off. Nice, Allie.
But I'm glad y'all could be here, and I'm glad to thank you, Allie, for inviting us and for having us and the rest of the CF Foundation. And if there's anything we could do, y'all could reach out to us privately. And I hope the rest of your night is fun and healthy. Talk to y'all later.
Stay healthy, everybody.